John Newquist has over 30 years in the health and safety field. Among a few accomplishments, John served OSHA from 1983 to 2012, where he was an assistant regional administrator. Newquist has trained over 10,000 individuals regarding safety and health training, completed on-site safety audits, and has been an expert witness on multiple cases. He has trained on important topics such as OSHA 10 and 30-hour courses, and OSHA 500, 501, 502, 503, 510, and 51. He has completed training in general industries and construction on important topics such as confined spaces, fall protection, rigging safety, work zone safety, crane signaling, and more. Mr. Newquist is licensed and certified in the following: certified environmental training, occupational safety and health, safety professional, occupational hygiene and safety, and much more. Tonight, we welcome and thank him for being here to educate us, to increase our knowledge about workplace safety risks from COVID-19 and measures that can protect workers. And thank you very much, John, for joining us and being a part of USMWF.
Thank you. Thank you. The hottest topic since March. I mean, you know, it seems like every week I'm talking about it, teaching in respirator safety and respirator fit test is going right along with that. It's also, so Tanya's going to advance the slides. Let's kind of go right into it. And we'll talk a little bit about the origin of the virus and everything else. It's a coronavirus. It means it has a corona like the sun, not from the beer. But it's a virus, and that means, you know, normal things like penicillin will not work on, or amoxicillin on it. And so there are several companies, 5 major companies that are working on viruses. They're in phase 3 trials. And if they're successful, you know, doing anywhere from 30,000 to 60,000 people, they're going to, you know, hopefully try to get an emergency procedure through to get the vaccine out in a shorter time. The phase 2 trials, I watched all 5 results of them. They were pretty positive. Almost 95 to 100% of the people developed the antibodies, which are good, but, you know, only 30 to 60 people. So when you start, you know, multiplying it to 30,000 or more, you know, now we're going to see if there's going to be reactions or anything else. We know from other things like polio, it didn't come out so good, the first vaccine. And so, you know, when people want to rush to it, you got to make sure it's safe for everybody, and you're not going to cause a lot of problems on it. So there were other ones. I mean, other viruses that have been through the history. You always probably heard of SARS around 2009. Very lethal virus. You know, sometimes up to 10% of the people who got it died on that. And so there's other ones that have been through it. A lot of people might have heard of Spanish flu back in the 1918 and 1920. But 500,000 people in the United States died. And we're about a third, 3 times bigger than that. So some of these viruses can be pretty lethal, and people are always saying, well, what are we going to take a look at and what are we going to do? So we'll go to the next one and talk a little bit more about the transmission issues.
This is kind of just a basic overview.
I hear you, Teresa. You know, when it first came out, we weren't sure what we had, you know. You know, China came out with almost 3,000 deaths immediately in the first month, and how were they dying? It was a mystery. You know, you could have viruses like hepatitis A and norovirus, where you touch it, put it in your mouth, eat a burger or whatever, and you're going to get sick. And, you know, that's why people were wearing gloves a lot of times, you know, when it first came out, because, you know, you don't know about this virus. You just know a lot of people are dying in China, and, you know, people are trying to protect it. When you breathe, you know, if you go in and, you know, in the wintertime, you can see your breath, those droplets can contain the virus. And that's the predominant thought right now, is the virus is transmitted by the aerosols in your breath. And that's good in a way, because, you know, aerosols are fairly large compared to, you know, microns for some of the viruses and stuff. So, you know, things like the mask and the face coverings and stuff can offer some protection. I get a lot of people beating up, you know, well, I've got a false, you know, face covering, and, you know, that's just worthless. And I said, well, you have to remember in the 1920s when Spanish flu came, in the 1924 with the bubonic plague in LA, that's all they had. They had gauze face coverings, and it worked. I mean, you know, they had to learn a lot of times, you know, how to wrap it in and make sure. But, you know, like I said, it's, you know, if you protect your face, the aerosols, you know, you're not going to transmit it, and hopefully it helps limit the amount you would breathe in. You're going to bring in something, but, you know, hopefully you're not going to breathe in 100% of that aerosol. Let's go to the next one. Also, you know, some of the viruses, you know, because a lot of people are having respiratory problems, you know, you have a tear gland, the lacrimal gland, where if you touch your eye, that virus could go down through an inhale, you know, through your nasal cavity, and you could inhale it. So that's why you were hearing a lot of things in March, don't touch your eye, and this is a big issue. And that was one of the other transmission routes that people have looked at, you know. So there are different ways that people, you know, could get it. And, you know, like I said, the CDC came out and said, aerosol is pretty good, and then it kind of disappeared off their site. So there's a lot of issues with the CDC, and, you know, like I said, you got to look at overall, you know, between, you know, Japan, South Korea, the European Union, and see what, you know, they're all thinking, because that's what I want to use. Let's go on and next one. So the symptoms originally were shortness of breath, fever, 99.4 or 100 degrees, dry cough. That was an interesting thing, a dry cough, not like a cough where people are spitting up and, you know, a wet cough. And then as they found out, there are other symptoms, and there's almost like 6 strains. If you follow the European Union, they identified 6 strains, and you can get muscle ache, headaches. One of the things is that there is a strong correlation between smell. One of the people that I know, they said, you know, all I taste is salt. I've lost my ability to taste sweet, sour, everything, and they've got a fever. And I says, well, you know, you got 2 of the symptoms possibly, and can you smell? And they said, you know, I can't smell the candles, you know. And I says, well, go get tested. You know, you've got something in there. We don't have to wait till shortness of breath or a dry cough. You know, a shortness of breath, a lot of times it's going to be oxygen. You can get these pulse oximeters that tell you what your oxygen is. And some of the people are getting like 85, 80, and that's a problem. And that's affinity for COVID and stuff. So when we look at it, you know, that's, you know, these symptoms is a combination of it. Now, a lot of people are focusing on the fever because that's easy to do. But, you know, when I talk to the people who actually done thousands of tests, you know, it's usually the dry cough along with the fever, not just the fever itself. You know, when they go in there, you know, when we were in my city, you know, they've done thousands of tests. People were usually, you know, coming in just for the fever, and most of those, 96% were not going to be COVID positive. But, you know, the people who are saying, oh, if I want to see somebody, you know, I look for the shortness of breath, or I look for the dry cough plus the fever, and that seems to be a correlation. So, you know, you don't want to be that person that waits till they're on death's door to go get treatment, because some of the places, you know, you might not know for 3 days. You know, there's instant tests that Abbott has and everything else, and there's, you know, reliabilities of, you know, 95, 98, 100%, depending on which test you have. So, you know, I always tell people, if you think you got it, you know, tests are free, at least in Illinois and a lot of places. Go in and get it done and make sure you're not going to be sick. Let's go to the next one. It's very similar to flu, but the biggest thing is that, you know, the sneezing is very common with the cold, and sometimes with the flu. It's not a common COVID symptom. It doesn't mean if there's not another strain that this couldn't be in there, but for right now, it's not going to be an issue. Flu is very common with headaches. They are seeing it on a lot of this issue. I'm watching one person I know in St. Louis, and they said, you know, I don't have a fever. I'm coughing. It's a wet cough. You know, it's a lot of spit coming out, but I am throwing up. And, you know, the first thing they start thinking is COVID. And I says, you know, maybe go to the clinic and get tested. You know, there's several of them by St. Louis that are doing it free. You know, have your wife go in and take you in there and see what it's like, you know, and wear a mask, you know. St. Louis or Missouri is one of those states where, you know, masks are optional, and, you know, we start talking about it. And he's in a high risk group, so, you know, in a high risk group, I always call the age. If you're over 50, you're in the group where you're gonna probably get it. If you're 20 years old, not so much, you know. So we'll see what happens tomorrow. You know, we went in there. They said they'd give them a result by tomorrow, so we'll see what happens. Next one. And the incubation time, this is the thing that's driving everybody crazy. Anywhere from 2 days to 14 days. So you can be infectious and not show any symptoms and pass it to everybody. There was a famous case in Chicago. The person was asymptomatic for 3 days and then started developing the cough and the fever, then went to a funeral, gave several people there, 3 of them died later, went to a wedding, gave people there. There've been a lot of these cases where people look perfectly healthy, and that's kind of deceptive. I was almost consider it like similar to hepatitis C, because hepatitis C, you can be infectious and not have symptoms for years. But this one is, you know, quite a big latency period, and people are watching, you know, that when they test them. And, you know, I'm surprised that people are getting tested, But what's happening with social tracing is if you have somebody that's been diagnosed positive, they ask you who you're working with, who you talk to, where have you been, and they try to call them up and say, hey, why don't you go get a COVID test? So when I got my COVID test in August, you know, there were 4 or 5 people there that were just there because they're in the 20s, but the person they were with became positive, so they said, I'll go get the test, and that's what they were there for. So, and I, you know, like I said, big difference, you know, when you look at the incubation period. That's one of the things people that, I don't feel bad, and you know, they could be infectious, and that's always a tough one. Next one. When they went and took a cruise ship out of California that was stuck with COVID patients and COVID people that are sick, and some of them died, the CDC went on the ship a couple weeks later, 17 days later, they actually found live viruses. So that kind of scared everybody in March. And they started looking at, you know, how long can it live on cardboard? Well, stainless steel, you know, it could live, you know, metal surfaces could possibly live 3 or 4 days. But, you know, again, the primary transmission is going to be in the aerosols, and they say up to 3 hours. That's some of the numbers that go. I try to get something that's been what I call peer reviewed. And, you know, the idea is that, you know, there are people who come up there and they speculate, you know, this is what it is, and a paper might talk about it. But we're talking about the medical community has to kind of look at this and see if the data is right and see if the material is right. Otherwise, some person on the internet or YouTube is not, you know, can say it, and they can be very convincing and may not be true. So, you know, a lot of times if you're handling a lot of packages and everything else, there are people just wearing gloves on it, and it's just a good precaution. Okay, next. Now, washing your hands kills the virus. That's been proven to be effective. It works well in a lot of the hospitals and other places. You wash it for 20 seconds, soap and water looks good. They found out alcohol, 60% alcohol is very good. Hydrogen peroxide kills it. So there's a lot of things that are fairly cheap that are good. Hand sanitizers like Perel, the minute people started saying, oh, Perel has this and meets the criteria, you couldn't find Perel for months. Only this month have I seen like things like Perel come back, and you see it in the stores. But everybody seems to be making sanitizers and stuff, and you got to be conscious of it. Now, this one I bring up because the local store, Hy-Vee, which is a grocery store, completely ran out of sanitizer. And the local distillery said, hey, we'll make it. We can make grain alcohol, and we can put in the some hydrogen peroxide, and it'll be a good hand sanitizer. You just got to be conscious when you see something like this, it's alcohol 80% with hydrogen peroxide. It's flammable. So you don't want to be putting a gallon of this in the back of a hot trunk. You're going to blow up the car. But this is something, you know, people have to be conscious of, that anything that's 60% or higher could catch on fire, and you got to be conscious where you put it and where you store it. You don't want to put it on top of a stove. You don't want to have it next to a hot, unventilated area where it can just literally cook and possibly start a fire. Okay, next. So social distancing has worked. It's worked with several items. They talk about staying away 6 feet. That's the primary thing they know from other viruses, from the bird flu, H1N1, all these other things. Wearing a mask, social distancing, got a great track record of success. So, you know, we tell people you need to start thinking about, if you're at work or you're at your office, this is what you want to do. You're going to be in a classroom, you're going to start doing social distancing with a mask. The key thing that they don't talk about that I always talk about is ventilation. Ventilation has to be in there. You cannot have a room with no ventilation and talk about how safe you are with social distancing and masks, because the virus is just going to be in the room. It's not going to go anywhere. It's not going to get sucked out. So the ASHRAE standards talk about 10 cubic feet per minute. AIHA came out with 6 air changes a room per hour. You meet either one of those criteria, I would say it's acceptable. So I'm often going into facilities just taking smoke tubes just to see if we got it before we go in and look at the ventilation systems, because I go to a lot of companies and schools and everything else. They have no clue. No restaurant knows if they got ventilation or not. And I says, well, it's on there. They give it into your manual. They tell you how many cubic feet per hour they take out. We can do the math of what your facility is. And they don't even have the manuals anymore. They just like, we bought it, it works. But I take a puff of smoke and it sits and it moves and it doesn't do it. That's not good. You know, you gotta have ventilation. It's a key component along with social distancing and other things. Let's go to the next one. So, you know, they talked about screening people. The temperature is easy to do. You know, you can get temperature gauges, you know, fairly common now. I mean, every store that is either a pharmacy or a kind of like a major grocery stores are selling, you know, infrared thermometers that you can measure your temperature. You know, you screen, and if they're high, you know, according to the meter, you wait about 30 minutes while they're inside, and then take them to a room and then do it again. And if not, you know, maybe start talking about getting to the clinic because, you know, they've got it. So that can be defeated. The French came out and said, don't take ibuprofen, take Tylenol. And the World Health Organization backed it. But I said, wow, you know, there's not a lot of research on this. I mean, the French, you know, just put some correlations on it. And they noticed people with ibuprofen seem to have some issues. And I said, there's not been a good study on it. And like I said, you know, the World Health Organization was kind of pressured to take it. But I tell people, you know, it's Tylenol is like 50 cents. So, you know, why not use that instead of ibuprofen? We don't know. I mean, it's one of those things. So here they are, they're screening for it. They talked about, well, I'm not socially distant. What am I supposed to do? So they make the hole small enough that the meter goes through. That was what we were doing at the beginning, because now you're staying back, and then when the person comes up, you get close and they can do it. Now there's stuff you don't even have to get nearby to go and do it. But I always tell them, you know, there's many symptoms. So you have to kind of evaluate the other ones. If people are hacking, like a dry cough, then you want to say, you know, you got a cough and it's dry. You're not coughing up any liquid or anything else. I'm concerned, and we might want to make sure you get a test, you know, because this is a common one. Again, and it goes back with the medical people I've talked to who found many COVID positive cases. It seems to be a common one that's in there. So get a health professional, evaluate. COVID tests are fairly plentiful in most of the country, at least in Illinois, but most of the area should be able to get one. Okay, next. So, you know, you go through it, and if you go out and measure it and you get, you know, this one, you know, is 102-degree temperature, you shouldn't go to work. You are potentially infectious. You're not feeling good. Doesn't mean you have COVID. You know, you could always get a flu or some other issues that, you know, a cold that could, you know, give you a fever. But, you know, you shouldn't be going to work with this high fever. Don't be trying to take Tylenol and, you know, reduce it that way and then say, I'll go to work and I'll be okay. But this is what happens with a lot of workers. You don't go to work, you don't get paid. They don't think they got coughing. They said, I'm not coughing, I'm taking Tylenol because I got to get in past this thermometer test, you know, temperature test. And that's not good. A good employer should sit there and have ability to sit there and say, you know what, we don't want you at work. We'll cover your time off, you know. But this is what we talk about. If this is an issue, and this is the thing people, I want to say, who kind of like, you know, COVID's not that big. But once they get a fever, it rings in your mind. You start thinking, wow, do I have the other symptoms? What are the other symptoms and stuff? So let's take a look at the next one. And it also said, I'm not, you don't have to back it up, Tanya, but, you know, you shouldn't require a COVID test to be negative to come back to work, because some of the COVID tests test for the virus. And if the virus has been killed or you've gotten immunity, it's still going to show the virus there up to maybe 30 days or even 60 days, depending on the test. So a negative test is not an assurance that they're COVID-free. You know, they should be COVID-free, but a positive test could be testing a virus that's dead, but they have remnants of it in there. And that was one of the things, you know, when they started looking at why are we getting these positives? Well, you know, they started looking at, well, it's got the virus still in the blood, but it's dead, you know. Cleaning and disinfection is what I talk about, seems like all the time since July, you know. High touch surfaces, stereos, anything you touch, knobs. If you're on a computer, you share a computer, which is not very common in a lot of businesses, but you got to make sure that that is clean, you know, literally every day. There's several EPA disinfectants. You got to use what you think is going to be better. Some are chlorine based, some are ammonia based, some are hydrogen peroxide based, alcohol based. You just got to find it. Generally, you know, I'm starting to see a pattern when Clorox cleanup got the England said, yeah, that works. You know, anything that kills like 99.9% probably will kill COVID. Remember, it's not a strong virus. Soap and water is going to kill this thing. And so we tell people, and I always push the ventilation, you know. And people said, well, what if we have a COVID patient that's positive? Well, you know, a COVID worker or a student. I says, well, you know, do you have ventilation? And that they always say, I have no idea. And I says, well, then you probably want to wear an N95 respirators because, you know, that's going to be a little bit different than maybe a surgical mask or face coverage. So go to the next one. And like I said, you know, the distancing is the number one thing. People are starting to put partitions in. You know, OSHA's had issues, and they've talked about like pharmacies and, you know, retail facilities where you maybe not be able to do this and, you know, hand change back to a person or other things. So it is not a substitute for the distancing. It definitely is not a substitute for ventilation. You know, you hear me beat up the ventilation horn, but that is the thing I think will minimize it, because dilution, you know, is going to be a good solution, as they call it. A lot of places are doing pretty good about the 6-foot markers and stuff like that. You train the staff, you cover the issues. But, you know, I always use this picture of the gym. You know, the gyms are like, you know, desperate to come back to normal. But the first thing I says, okay, you got the partitions, but they're not wearing masks. That's not any good. You don't have social distancing. Do you have any ventilation? And, you know, the ones I go to, nobody knows. We have some ventilation, but I don't know if it works. So, you know, if it doesn't work, it's blowing around. And like I said, I just take a smoke tube. And if the smoke tube just sits here, then, you know, you don't have any ventilation. And all these people are going to transmit it, plastic barriers or not. It's incredible, you know. So these are things where people give the illusion of safety, and it really is not safe at all. The next. And then, like I said, you know, even at the lunchrooms, we try to tell people, make sure you got 6-foot spacing, got ventilation in the area. Some people are putting up barriers, but, you know, the idea is try to keep it in. You're going to, you know, you can't eat lunch with a mask. You know, so my school district said, you know what, we're not going to have people eat lunch. You know, we're going to do 4-hour classes, take a box lunch home to you. And, you know, if you come in the afternoon, you get a box lunch in the morning, and you can go eat outside or in the cafeteria. But they're trying to limit the amount of people in the cafeteria. Most of the companies I'm dealing with, they have lunch go from 10:30 to 1 o'clock now. They've staggered it. Instead of everybody takes break from 11:30 to 12, they're starting to spread it out. They're trying to cut it in 4s so they can take and move a lot of people through a period of time, not in there. And same thing for other areas where there'd be bathrooms or time clocks or anything else. They're trying to work on the social distancing and stuff. So that's an issue you want to go into. And I bring up an Ohio study that they just did in August. You know, when you want to go into a non-work environment and get COVID, the number one place is a bar or a restaurant, indoor. And again, I go in there, and I've been in the restaurants. I take the smoke tube. I ask them. You always ask them first. You don't want to do it because, but you know, you go there right at the beginning, and there's not a lot of people. And I says, see, it doesn't move. You know, you got the masks on, but the patients and the patrons and the people, they're going to be taking the mask off to eat or drink, and they're going to spread it out, and you don't have anything. I mean, that's not a good situation. So, you know, I says you got to start thinking about getting some ventilation in, or if anything else, at least air purifiers. We'll go to the next one here. So when you go in there, you know, the one thing I found out, I was a big fan of the cloth. You know, it's cold outside, go wear the cloth mask. It was pretty good. And they were pretty, you know, like I said, it's some protection. But, you know, when you get into the high risk occupations where you're dealing with COVID patients, you know, are positive, you're going to probably go to powered air purifying respirators that blow constant air on there. And, you know, you got to make sure it's going to fit. You got to make sure people have had a respirator fit test. Any respirator from an N95 to a half mask cartridge, you have to do a respirator fit test. What I found out that's been stunning, 98% of the people were not getting a respirator fit test. They just said, put it on, blow out. I says, that's not a respirator fit test. You got to use Bitrix, saccharin, Iridium smoke, you know, whatever system that's out there, corn oil for a quantitative test. You just don't give them a respirator and kind of hope it works. That's not a fit test. You know, there's actual protocols in Appendix A of the OSHA respirator standard that tell you what you actually have to do. All right, let's take a look at a couple more. And again, you know, delivery people, you know, a lot of the warehouse distribution center, everybody wears gloves. Good. Minimize the contact. Next. And then hand washing. You got to do it. I've never washed my hands so much in my life. You know, before you eat, after you eat, you know, all these things, talk about 20 seconds, you know, and that's not hard. You know, you count, after a while, you learn to count to 20. I can sit there and put the stopwatch and I can hit 20 seconds because I do it a lot. Next. And then put signs, you know, people, you know, just remind people because not everybody is watching the news, you know. So wear the mask, hand washing. Everybody washes. You get done, go wash your hands, okay? And we'll do 2 more. Restrict travel. You know, that's why Zoom is popular. We don't have to go to a meeting. We can do it virtually. You know, people thought, you know, when it first came out, they wouldn't do it, but it's not that bad, you know. And then let's go to 2 more and then we'll turn it over here. So, you know, we always tell people if they're going to work, you know, if they're not critical, they can do the work at home, let them do the work at home, you know, maybe bring them in once a week and stuff. So I see things like this in the first, you know, and I get these companies, oh, we're proud, look at this, you know, and I says, what's the ventilation? I don't know. You wear masks? Yeah. You don't know what the ventilation is, why not? I mean, that's a pretty simple guideline, you know, so, you know, this is baby good, you know, they don't have studies that show that this is going to work. They got hope that it'll work. But, you know, like I said, we know social distancing and masks work with good ventilation. Okay. And the last slide we'll cover. And then make sure you screen the visitors. You know, so most of the companies that are pretty good, I got to fill out a visitor form. Have you been to a country with COVID? Do you have fevers, cough, and all these symptoms? And I sign it, I don't. And then it usually goes to a top management official that makes the decision to let the person in. Because I should be in there only because it's a critical issue. I shouldn't be there just to push a product or sell something. I'm there for a specific issue or an accident or something else like that. So Tanya's going to have the presentation up there, and thank you very much for listening to me, and you got my contact if you have any information. Okay, Tanya. I don't hear Tanya now. Tanya is muted according to Zoom.
I'm muted. I'm sorry. Thank you so much, John. I wanted to make sure nobody heard my background noises. If we wanted to take a few minutes, just for, if you had any questions for John, and then if we had any at the end of Debbie's, you can definitely ask additional. But did anybody have any questions for John in regards to his great presentation there? I know he had a lot of information, and there's a lot more in regards to COVID that I know that could be discussed, and unfortunately with an hour, we can only go so much.
Hi, this is Jazzy Graywell. Sorry for joining late. I'm with UFCW Western States Council out in California. John, I missed the first half of your presentation, but I did hear you mention how important ventilation is. It's really true, especially in the meatpacking facilities. Those plexiglass screens mean nothing if the ventilation isn't good, because workers are still getting exposed, and that's what we're seeing in our meatpacking and processing facilities. So really stressing that importance. But I have a question about disinfection. Do you have like what are you using to disinfect? What is like the standard, the gold standard for disinfection? I've been seeing conflicting things and not seeing enough information related to disinfection and sanitation, and so just didn't know if you had good resources for that particularly.
There's the EPA site has it. The big thing is that there's a dwell time. When you take the disinfectant, in order to kill it, some products require 10 minutes soak time on that surface to get rid of the COVID. Some products only require a minute. So you got to know that issue. You just can't spray it and then wipe it and walk away in 10 seconds. That's not going to kill it or properly disinfect it. So that is something I always tell people, just follow the instructions on the EPA disinfectant. You may find ones that are good. Some people don't want to use chlorine ones, you know, because it might react with something, you know, but there are different ones that are out there, and just follow the rules. But you got to have at least a minute to 10 minutes of soak time to get rid of the virus.
And this is Debbie Berkowitz, and you just need to also be careful that the workers that are doing the disinfecting have protective equipment, because some of these can be pretty hazardous. So
yeah, I'm showing them in Tyvek and respirators, because like I said, if they're an irritant, not something you want to have on your skin. Okay, thank you. We'll let Debbie go on. Tanya.
Hi, everybody. I'll try to be quick because I know it's late at night. So I don't know. Tanya, do you want to introduce me, or should I just do my thing?
That's okay. Just start. Sorry, this is Debbie Berkowitz, and she's with the National Employment Law Project, and is the Worker Safety and Health Program Director since 2015. I was honored to meet and get to know Ms. Berkowitz, as she served as Chief of Staff and then a Senior Policy Advisor for 6 years for the Occupational Safety and Health Administrator. Ms. Berkowitz has many achievements in the field of occupational safety and health, and she has held positions including Health and Safety Director of the United Food and Commercial Workers Union and the Health and Safety Director of the Food and Allied Service Trade Department of the AFL-CIO. We are honored to have her join us this evening and speak about workplace safety rights during the coronavirus pandemic. And please join me in welcoming her this evening. Thank you very much for coming here today with us. Thank you.
Well, always happy to help, Tanya. You do wonderful work. So I'll just be really quick, I think, because Tanya asked me to talk about workplace safety rights. So worker safety is really in crisis in this pandemic because, you know, when we're, you know, I work in a white collar job, so I can telework and then I can decide to stay 6 feet apart from everybody when I go outside and wear a mask. But for workers, especially those essential workers like Jassy talked about, meat and poultry workers, warehouse workers, supermarkets, healthcare workers, you know, you don't have that luxury. You go to work and your boss tells you what protective equipment you need to wear or not wear and tells you to stand, like for meat packing, you got to stand shoulder to shoulder. We don't care what CDC says. And so what you've seen is that in many workplaces have become hotspots. They become the vectors where it's spread like wildfire through certain workplaces like nursing homes and meat and poultry plants and warehouses and others, and then spread out into the community because COVID-19 wasn't, the exposure to it was not being mitigated at work. And that's because not every employer was, you know, doing what they were supposed to do. And, you know, John went over that CDC, the Centers for Disease Control and Prevention, and OSHA have issued guidelines. These are voluntary. Employers can follow them or they can ignore them. That's really all they are. And the guidelines have really been the same, really from the first week of April. It's been 6 feet apart, everybody in a mask, stepped up ventilation, the ability to wash your hands or hand sanitizer frequently, reporting and letting people know when somebody is sick, having exposed or sick workers out of the workplace, except of course, if you're a critical infrastructure. And then the president said, no, you have to go back to work, which was really a mistake. But, it's basically been the same protections, but unfortunately you haven't seen uniform implementation in the workplace. And most of you know, if you've worked with Tanya before, that there's an agency called OSHA, whose job is to assure the health and safety of all workers under their jurisdiction, which is really almost all of the private sector, if you're an employee. And, you know, there's a separate agency for mine workers, but it really covers most private sector workers. And the way OSHA works, it's almost 50 years old, is that OSHA sets standards that employers define safe conditions, like how much noise you can be exposed to in the workplace or when a machine needs to be guarded. And then they enforce the standards through on-site inspections. And the way they target their inspections is if there's a fatality, OSHA always goes out and does an inspection to figure out why, or if 3 or more workers are hospitalized, or if workers file a complaint, are like primary ways that OSHA does inspections to target industries that could be dangerous. Now, you know, OSHA is a very small agency. I just want to begin with to tell you that even during the years when I was there under the Obama administration and we got extra inspectors, it still would take OSHA like 130 years to inspect every workplace once. OSHA just doesn't have the resources to do that. But they are in charge of making sure that employers provide a safe workplace. And in this pandemic, OSHA has failed. Federal OSHA has enforcement jurisdiction in 29 states. In 21 states in the United States, some state agencies were given the ability to enforce the law. So you're going to hear me talk about these two different things in a bit, but federal OSHA has failed. And when this pandemic started, it was really clear that this thing was racing like wildfire, first in meat and poultry plants, in hospitals, in healthcare, in nursing homes. We now have 42,000 meatpacking and poultry workers that are infected, and that doesn't include states like Nebraska, because nobody has to report that data. It's just gathered by nonprofit groups that go around trying to get the best data they can. We know there are over 200,000 healthcare workers have been infected, and that's only based on 20% of the test data that's coming in. You know, right away, there wasn't enough masks for healthcare and hospital workers. N95s is what they always should wear, but the government didn't have enough to send around. The administration decided not to invoke the Defense Production Act, this law that would have let them prioritize the production of N95s. So we still don't have those kind of masks. And in fact, if teachers all could get N95s, all the schools could be open a lot quicker. But even healthcare workers can't get them. And that's one of the reasons it's spread in nursing homes. But what happened with OSHA here is that even though they were petitioned by the AFL-CIO and about 100 other organizations, they decided not to issue any standards or any requirements of what employers need to do to protect workers. They just issued voluntary guidance. The CDC did and OSHA did. And if you've been paying any attention to the news, you know that CDC has totally watered down their guidance because of political influence and also corporate influence. In fact, just the other day, it came out that the CDC issued some guidance to a meatpacking plant in South Dakota, and then somebody complained, and it went all the way up to the USDA and the head of CDC, and they ordered the guidance be weakened. They overruled their own scientists. So that, you know, for a worker, it's like you're really on your own, because even the CDC guidance has been watered down than what it should be. And OSHA didn't set any requirements. Federal OSHA set none. And the truth is that, and John knows this, that even when OSHA doesn't have a specific standard, it can still enforce basic, you know, safety precautions to employers. There's something called the General Duty Clause of the law. And under that law, under that clause, it says every employer has an obligation to provide a workplace free of recognized hazards that can cause serious physical harm or death. It's what OSHA uses to cite employers for violations of excessive heat or carpal tunnel syndrome and tendonitis. When they don't have, because OSHA doesn't have a standard for everything because it's a small agency and it takes like 10 years to write a standard. But they always have used the General Duty Clause. In fact, Ronald Reagan cited an employer, a meat packer, right there in the state of Nebraska in the end of the 80s for like $3 million under the General Duty Clause for crippling workers with carpal tunnel syndrome. But OSHA decided they're not enforcing the CDC guidance. They're not going to use the General Duty Clause. That's what they decided at the beginning. And they also decided to do almost no on-site inspections. So 9,000 workers filed federal complaints with federal OSHA. Many of them signed, detailed about the hazards, workers throwing up, workers sick, we're working shoulder to shoulder, there are no masks, there's no protective equipment, we can't wash our hands. And OSHA simply told companies to investigate themselves by a letter or by an email, and they closed the case. And then outbreaks occurred because OSHA didn't do anything. And there's been a lot of outcry about how little OSHA's done. And it's not just federal OSHA. Iowa OSHA, for example, has done really nothing. And they've had some of the largest outbreaks in meat and poultry plants in that state and in nursing homes. And they just refuse to inspect, and the outbreaks continue. And really, for all of us, we know that if you want to mitigate the spread of COVID-19 to all of us, you have to stop it in the workplace. That employers have to provide safe conditions. They have to mitigate the spread of COVID-19 at work. And that will then prevent it from spreading out into the community. Because you'll see, if you look at a map of sort of where the communities are most infected, you'll see a lot of them are where there are industries where it just raced around that industry, a nursing home, a meatpacking plant, a poultry plant. At the beginning of the pandemic, it was supermarkets. And it's because of the unions, really, that any of protection has been put into place right away at the beginning of the pandemic. I mean, the USMWF led the fight there for supermarket workers to wear gloves and to be given masks and face shields and 6 feet apart, and the ability to use hand sanitizers. That was because the union insisted on it. OSHA hadn't required it, and OSHA was not doing inspections, even though supermarket workers we're complaining and saying sort of we need help. So, it's really stunning to me. It's stunning to John. Those of us that worked at OSHA, those of us that use the agency or worked with the agency for 40 years, OSHA has never walked away from citing employers who really were thumbing their nose at safety. In 2009, when I joined OSHA, there was an H1N1 pandemic that most people forgot about. And that was not as deadly a disease, and it wasn't as contagious as COVID-19. And, the focus was on protecting healthcare workers. And right away, CDC issued some very specific and good guidance. And OSHA said, we're going to enforce that guidance. We're going to enforce it under the general duty clause. But in this pandemic, there was a different philosophy. It was, OSHA was just not. I mean, so many workers called OSHA and said, please come into my workplace or call my employer and tell them what to do. And they said, it's not our jurisdiction, or we don't have a standard. We can't require anything. We're just going to tell them to self-investigate, and that's all we can do. So it's really been a failure. OSHA has finally started doing on-site inspections. Some of that is in response to fatalities, but not a lot. They're more concerned about protecting their inspectors who have access to all this protective equipment, and they could be doing it because they know the workplace is so dangerous, but still they have an obligation and they are abdicating their responsibility. I think they've issued 9 citations, all teeny weeny citations, and only after workers died. Multiple workers were hospitalized and are, still suffering from the illness. And it's really just a slap on the wrist to employers. So it's not an incentive for employers. It's not a message to employers to sort of clean up. And so what's happened is a lot of states and state governors have moved forward because the federal government has failed here. So some states have actually passed some really good protections for workers and are enforcing it either through the health department or the attorney general in the state, or they're enforcing it through their state OSHA agency, like Minnesota and Michigan have very good protections. California has very good protections for healthcare workers and is starting to enforce through their version of the general duty clause. And they've issued more citations in California than federal, like many times more than federal OSHA has in this whole pandemic. Virginia OSHA wrote an emergency temporary standard. So there are about 13 or 14 states that have implemented some protections. I have that on our NELP website, and I'm happy to send it to Tanya, but but that's only 13 or 14 states, where everywhere else workers are really on their own. And so what we tell workers is to call the health department if your company's not allowing you to social distance, because workers don't have agency when they go into a workplace, especially low wage workers or manufacturing workers where it's non-union, and they're very terrified to sort of stand up. OSHA has very weak whistleblower protections, but if somebody gets retaliated against or discriminated against for raising a concern, you can file a complaint with OSHA. You have to give your name, you have to give a statement, you have to do it within 30 days of when the discrimination occurred in most states. But OSHA has a really bad track record on this with COVID. I just looked at the data, and I'm about to come out with a report, and about of the 1,700 cases that they received by mid-August, they've already dismissed half, and only about 30 of them have they gotten anything for the worker on. That's 6 months into the pandemic. So it's not really a right that you can count on. And I think what this pandemic has exposed is just how weak worker safety rights are, because if you file an OSHA complaint and OSHA doesn't inspect, you don't have the right to go to court and sue the employer for not complying with the OSHA law. There's no right to sue built into the OSHA law. OSHA's it. If OSHA doesn't act, then workers really have nothing. So, you know, we've been advising workers to sit a band together, to use the media, to reach out to the press, to call the health department, call the governor's office, call their local legislators. I mean, employers, as John laid out, it's not rocket science. It's really simple how to protect others from COVID-19, how to protect workers from COVID-19. It's 6 feet apart. And, meatpacking and poultry workers all over this country are still working shoulder to shoulder, that the meat industry has totally decided not to protect workers, really, to give masks, which is really critical, especially, and ventilation. We have known for months that it is aerosolized, that it's not just when somebody coughs or sneezes, but when somebody talks, that you can get COVID-19. And so ventilation and lots of fresh air is really important. And then, of course, hand sanitizers and the ability to wash your hands, what, John was talking about, that's the normal precautions. And also notifying and telling workers when a coworker has COVID-19. And then what I think is probably one of the worst things the CDC did, and they did it because the meat industry, Tyson's and others, met with the vice president's task force and said, we're having a worker shortage. It's been racing through our plants and so many workers are exposed that we have to nobody can come to work. And so they put on April 8th, CDC put out guidance for all essential workers, even though it was just the meat industry that they were focused on, that if you were in a critical infrastructure industry and you were exposed at work where your coworker got COVID and you work with them for 8 hours, that they can make you come back to work. And that's why it's spread in these plants, because as John said, there is significant spread from workers who are asymptomatic and pre-symptomatic. And you just, you punch in together, you go to lunch together, you're in the locker room together, and you're working side by side. And that's how it's spread, and it's how it's spread in a lot of critical infrastructure. And so that guidance is really bad and should not be followed. Companies, responsible companies, if you've been exposed or you have COVID, they should tell you to stay home and they should pay for you to stay home. Because like in Iowa, the governor announced that any worker who's too scared to go to work because he or she's been exposed to COVID-19 at work would not qualify for unemployment insurance. So then they would have nothing if they stayed home. And so it's really important. And I think a lot of unions have negotiated this to have workers get paid quarantine. The Family First Coronavirus Act actually provides payment if you're in an employer that's less than 500 people. So I think, the landscape for worker rights is not great. And, there's a bunch of us fighting very hard to try to get OSHA to step up and state OSHAs to step up. And in some states, we've really been successful in passing some good. The governor's got executive orders like in Oregon and Washington and Michigan and Minnesota and Illinois and Pennsylvania, New York, New Jersey, and Rhode Island, Massachusetts, pretty good. But in other states, there's sort of nothing. And, I think that's why worker safety is in crisis right now. So thank you.
Thank you very much. I greatly appreciate everybody. John, Debbie, you guys have brought so much. I mean, now my mind's going like, oh, what can I do? What can I do? So does anybody have any questions for Debbie? I mean, there's so much information that we've learned, and I know there's so much more that an hour's just not enough. So please, questions out there for you guys. Anybody?
I just have a quick comment. Debbie, you brought up a point that it's really important for coworkers to notify each other and the employer to notify each other when there's an exposure. And we in California just passed, or just got signed, it will go into effect January 1st. It's AB 685, which mandates that an employer must notify their workers within 1 business day when there's a COVID exposure at the workplace, because it's just so important, and workers are being left in the dark throughout facilities all over California, and didn't know when there was an exposure, or heard from a rumor mill, or saw a worker didn't show up one day and figured, oh, they're out for 2 weeks, it has to be COVID related. And so we were really excited to be able to pass that, and looking forward to being able to implement it. And one of the things also that we get through that bill is the union will be notified of the worker who was exposed and was positive. And so we as a union can contact trace and work with the employers to do that and figure out who was that worker near, who needs to be tested, who needs to go to quarantine, how do we provide them sick leave benefits, and actually make sure that they're getting those benefits. And so I just wanted to throw that out there.
That's a great new bill that y'all passed. 2 things passed. One is a presumption on workers' comp for all essential workers who get COVID. The presumption is they got it at work. And the other is this great other bill that provides all these rights. So good for you. Kudos to everybody in California.
Yeah, the workers' comp one is a little more interesting now, because we did have the rebuttable presumption, but that has since expired, and they passed a bill that actually now requires a trigger. So if you're over 100 employees, you actually have to meet a 4% trigger within 14 days of positive cases. And so we're not so thrilled about that piece, but at least for the healthcare workers, fires, and cops, they did get a rebuttable presumption, which is really exciting. So still work to be done. Always work to be done.
Right.
I had a question, and maybe I have a neighbor who happens to be a teacher, and she had brought something to my attention. If a student has COVID, is it her right to know that a student in her class has the virus, or is it a HIPAA violation if she is notified of it? Does that make sense?
Why is the student in the class? Why isn't the person isolated?
And
They shouldn't have anybody in the class that's COVID positive.
Right, except there's a story in the Washington Post today about how in Wisconsin, parents are sending students who are positive. So
Yeah, I read that, and I just said, well, wait till the lawsuit's hit. I mean, you cannot be a school district knowingly having a COVID student. You're talking about $1 million of settlement. It's a great lawsuit that a person gets it. Their costs you're going to pay for as a school. It makes no sense. You talk about the symptoms, you tell them you got these symptoms, you stay home. You don't bring your kid there. And if a parent knowingly does it, they're risking their fortunes on it too. I mean, it's crazy.
So, Tanya, your state has no requirements on anything with COVID, but there's no HIPAA violation to know. You don't have to know the person. There should be an announcement that a student has COVID. I would assume that if it's a student that, CDC, one of the first guidelines was that employers have an obligation to tell coworkers or other students if they've been near that person. So everybody should quarantine. So the school should have everybody in that class quarantine.
That's what I thought, but no.
It's not a HIPAA violation until you say the person's name, but you can say
there's somebody who's positive in your class. Yes.
And therefore, we're going to do contact tracing and figure out, who this person ate with and this and that, and tell them, and they all have to quarantine.
Right. That's what I thought. And that was my concern about it all too. So no, I agree. That's what I thought.
My dad was a high school teacher, so I'm really, you have to protect our teachers and protect other families. Yeah.
So yeah, no, that's where I was too. So yeah, any other questions or any pointers that you guys wanted to bring up real quick? We have a couple more minutes left.
Hello, this is Marcella. Can you hear me?
Yes.
Yes, Marcella.
Yeah, I have a question because I am considered an essential worker, and I work in a assisted living for Alzheimer's dementia. And I happen to be immunocompromised, and I have 4 underlying medical conditions that would be really bad if I got the virus. But the virus has come into our facility, and we have 9 out of our 12 residents have contacted it. 3 of them have passed, God rest their souls. And 12 out of 15 employees have gotten it. Praise the Lord, I'm one of them that hasn't got it yet. And I'm just wondering, because with my breathing trouble and stuff, I can't wear an N95 mask. So I was told that if I just wear a standard mask and a shield, and then the gown and gloves, that I'm protected.
I'm going to tell you, your employer should be buying you a powered air purifying respirator that supplies the air to you through a P100 filter. There's no excuse. It's $300. They give no excuse that you can't spend the money to give you the proper respiratory protection that lets you breathe clean air through a P100. Filters out 100% of the particles, 0.3 microns.
Okay. All right, because my concern was, I did bring my concern up to them, and we don't get sick pay or anything like that. So they told me, well, you can just go ahead and quit and collect unemployment. I've been there for 13 years.
What a nice employer.
Yeah, that's what I'm thinking now. That's what I'm thinking now. So I've had my 10th
I would
COVID
call
test.
OSHA and ask them, you're in a high-risk occupation. You have COVID residents. You should probably be considered having at least access to powered air purifier. I know there's problems with OSHA, like Debbie said, but I would at least put that facility on record that they should be giving you powered air purifying respirators.
What state are you in, Marcella?
I'm in Nebraska.
Oh, your governor just doesn't care about workers, but there is a law called the American for Disabilities Act, and you probably should try to, is like Legal Aid or ACLU to contact them in your state.
Okay.
Because you may, with COVID, it's like your underlying conditions give you a disability because you're so much more at risk. And they should have to make some kind of provisions, like have you work in the office or something to protect you if they're not going to get you that air purifying respirator.
Right. See, we don't have an office. It's in the house. It's like a home-like setting. There is no office or anything like that. And I doubt that there's any ventilation. It's just their standard house is proper.
Okay.
But basically,
More the
so
reason to sit there and have this powered air purifying.
Right.
There's no employer
Okay.
that says they can't spend $300. I'd make them look like fools if they were in court.
okay. Well, I'll mention that to them, because so basically what they told me with just the mask and the shield, I'm really not protected then. Correct?
No, because let me ask you, the mask is not an N95, right?
No, it's not. I can't breathe with
No.
those due to my emphysema.
Okay, so the problem is there's going to be so much of the COVID virus getting into you. How much? The mask and the shield will reduce it, but the N95 is 100% protection. You're in a high-risk occupation. You're not in a low risk at an office or something else. You're in a high risk. They need to protect you by getting you a powered air purifier.
Okay.
And
All right. Well,
I
thank
would
you.
call, like I said, work with Tanya, call OSHA, put the complaint in that employees do not have access in a high-risk environment.
OSHA's not going to do anything but send your employer a letter, but maybe
I know, but I mean,
Tanya
I
and
would at
John.
least have that on the record, and
Yeah.
bad publicity does wonders for a lot of places. I would have no problem hitting the media about this and everything else. I have no sympathy for these employers that don't want to spend $300 to get, the few people that are working there to get the proper protection, especially when they know they can't wear N95s.
Right. Yeah. I mean, we're required to I don't know if the CDC said that we have to be tested weekly until we have no new cases of COVID for 2 weeks in a row. I've just had my 10th COVID test, and I'm waiting for the results of that, but so far I've been negative. So, yeah, I've kind of, I thought maybe I was protected with the mask and the shield, but now I know I'm
You
not.
have some protection, but you're in high risk. That's a little bit different than if you're in a office or something else.
Yeah. And one of my
Given that you're
residents
working
just
with
passed
sick
away.
patients, I agree. It's different if you were in a supermarket or something.
Right.
But you're working with sick, infected patients, so yeah.
And you have no ventilation, probably.
No, I doubt it. I doubt it. Because like I said, it's a house. So, okay. Thank you.
Thank you, Marcella.
Not what I wanted to hear, but thank you.
Well, thanks for sharing. On that, I'd be happy to call it an evening. I apologize. I know that there's many more, much more time we could use on this topic. It's very important. Again, Debbie and John, thank you so much for your time and joining us this evening. You guys are amazing experts on all topics. So I greatly appreciate your time. It means so much to me and everybody. I thank everybody for joining us this evening.
Thank you very much.
Thank you
Thank
for your
you.
Enjoy the
time.
day. Have a good weekend.
Have a great
Stay
weekend.
safe.
And
Thank
stay
you.
safe. We'll see you next month. Thank you, guys.